Get more analysis from Einar Tangen, who joins me now from Beijing. He's an independent political and economic affairs commentator, and he joins us now. Einar, good to have you on the show. Up until now, so Beijing had sort of maintained that no one died of COVID in the city. I mean, do you think that this is a claim that was questionable from the very beginning?
No, I doubt it, because it would be very hard to hide if you had people. I mean, you have to remember, this is a zero COVID country. So anybody who was admitted to hospital and with COVID, they would be in isolation. They would be on some sort of respirator, probably a 99% chance before they would die. And therefore, their death certificate would have to reflect that. Right now in Shanghai, the leadership has basically been removed because they did not follow procedures. They did not report accurately. So this is not something that officials in China are going to trifle with.
Now that 3 people have been declared dead, I mean, do you think that this is because that authorities have decided that they need to sort of make the public more aware of the dangers of this virus? Because when you look at sort of the stats of the people there, I mean, barely half of the country's over 60s population is fully vaccinated. I mean, could this be an underlying reason?
No, it's the underlying reason why China has adopted this zero, tolerance basis. They don't have the acute critical care facilities. For instance, in China, they have 3.6 critical care beds per 100,000 people. In the U.S., you have well over 30 per 100,000 people. So that's why China has been forced to make it. Now, in cases where they've had outbreaks, they've been able to mobilize, move makeshift hospitals in, and take a kind of critical care approach to these things. But it's not something they could do all over the country. This is one thing people fail to understand. So this idea that somehow it's all the numbers are being fudged, I think is just being put out by countries who have not been able to handle the coronavirus as well as China, and want to cast a doubt on it. Remember, China's had less than 4,650 deaths. Compare that to with China, Europe. I mean, the U.S. has had 1 million, literally 1 in every 6 reported cases. The WHO has said that related deaths are probably triple that number. Could be well above 18 million worldwide. So, you have to look at deaths that are reported by COVID-19, deaths that are due to people who could not get care, and in other cases, deaths that were due to alcoholism, drug use.
I want to ask you something that's also been reported that we've seen come across social media throughout this lockdown in the city of 26 million. Some people have been extremely frustrated. Do you think, how much do you think the divisions, you think the tensions of the citywide lockdown has brought among the residents of Shanghai, not only between young and old, but also between locals and outsiders, and most of all, people who are COVID positive and COVID negative?
Well, I think it's a little bit overplayed. I know people there. I can only speak anecdotally about them. But, the fact is, people are tired of COVID-19. Unfortunately, COVID-19 is not tired of them. And there is a tremendous amount of frustration. The way to deal with it is not to pretend that it doesn't exist and say we should just allow lots and lots of people to die because we don't have the proper medical care and we couldn't intervene. The key is what the government is doing, which is they're instituting new policies and procedures that allow factories to, in essence, have their workers live and work in the factories, and they isolate them and allow them to continue. This does not help retail, but these are different strategies. Remember, COVID-19 has been evolving, and you have to evolve the way that you treat it as well.
Okay. Einar Tangen, we'll leave it there for the moment. Thank you very much for joining us here on the NewsHour. Do appreciate the analysis. Thank you.